Hi, I'm Dr. Bharat Reddy. I'm a trained pediatric pulmonologist who deals with chest diseases in children. This interesting area of pediatric sleep actually comes under the purview of pediatric pulmonology because it involves breathing problems in children during sleep. Hence, we are trained as pediatric pulmonologists to also deal with sleep disorders in children. Sleep is an essential body function for all of us. If you think about it, we nearly sleep for 1/3 of our life, and nobody really knows what happens during this 1/3 of our life. Hence, sleep is a very important part of our life which we need to understand. Firstly, it's important for physical health because it maintains your cardiovascular system, it maintains the blood vessels in your body. People who do not sleep well are shown to develop diabetes, hypertension, stroke, obesity, and problems with weight issues later in life. Secondly, it's very important for mental health. It is shown that the number of stress hormones which are there during sleep come down. So we're much calmer during the day. Our performance is much better during the day. Learning, memory, and all other physical activities are much better during the day if we sleep well at night. Now, for children, it's especially more important because sleep plays an important role in growth and development. So the growth hormone which we talk about in a child is secreted predominantly during good sleep. So if a child sleeps well, he grows well and develops well. And lastly, it plays a very important role in immunity. So a child who sleeps well is shown to have better immune function than adults. So sleep in children varies according to the different ages. For example, the sleep required for a newborn baby is much different than what a teenager or an adult requires. So if you look at this picture, the amount of sleep which is required by a newborn baby is around 18 hours. That by an infant is around 14 to 15 hours. A toddler, a person who's preschool, approximately requires 12 to 14 hours. A school child needs to sleep around 10 hours. And a teenager, around 8 to 9.5 hours. As adults, it's okay if we sleep around just 8 to 9 hours. But as you can see, none of the kids follow this particular chart, especially teenagers. And also note very importantly that it is not the quantity of sleep which is important, but the quality of sleep which is important. It's not okay if you just sleep for 10 hours, but the quality is poor. So as sleep specialists, not only do we concentrate on this quantity of sleep in a child, we need to ensure that it's good quality sleep in the child. So nearly 25 to 30% of children are shown to have issues with sleep. This is as per international data. And these are reported problems in children. So I'm sure there are much more than that. So the problems with children present are a little different from adults. If an adult doesn't sleep well, he will be excessively sleepy during the day, he will yawn a lot, he'll fall asleep during sessions, etc. But in the child, it's the other way around. The child will be hyperactive. So this child will be extremely active, extremely irritable, will be a bit groggy. Child will be extremely stubborn, start throwing tantrums, etc. And other issues we can also start looking for in a child is if they're moving their legs a lot during the day or night, if the child is not achieving bladder control at night, or if the child as such is becoming extremely difficult during the day to manage. These are all signs that the child is not having good quality sleep at night. The common problems that most parents come to us first most commonly is difficulty in a child initiating sleep. In children who are much younger, for example, babies and infants, parents' usual complaints is that the child is awake throughout the night and sleeps during the day. In much older children, we start seeing nightmares as well as night terrors. A very common problem is also called restless leg syndrome, where this child keeps moving the leg at night or starts kicking each other at night. That also indicates the child is not sleeping well. But one of the most important sleep disorder we think about is obstructive sleep apnea, or what we call as OSA. And a lot of sleep specialists focus on this particular problem in childhood, which manifests early in the form of snoring. So we'll mainly look for sleep terrors, sleepwalking, sleep talking. All of these are issues which we see commonly in children. So obstructive sleep apnea is one of the most serious sleep issues in children that we see. What happens here is that the breathing of the child is obstructed. As a result, the amount of oxygen that goes to the blood is much lower in this child. This can happen commonly due to enlarged tonsils and adenoids which is seen in this age group. So in a child who presents with all the signs and symptoms which I mentioned previously, like excessive grogginess, hyperactivity, or decreased performance even in academics, we should suspect a probability of obstructive sleep apnea in this child. So of all the signs and symptoms that we mentioned, like hyperactivity, excessive sleepiness during the day, and grogginess, child being extremely irritable, Or as I mentioned, if the child's performance in school or in daily activities is coming down, you should always seek the help of a sleep specialist or seek the help of your doctor. It's important for us to remember that it's the quality of sleep of a child which determines his performance and activities during the day.